On the program today, the military is focusing on extremism within its own ranks. In the process, are we missing extremists coming into the country from the southern border? We'll talk about that with Congresswoman Vicky Hartzler. Also, how did a provision in the National Defense Authorization Act that would have forced women to register for the draft get stripped out at the last minute? We'll talk about this good news story and this victory for common sense a little later as well. Also, a doctor's response to President Biden's speech today on Omicron. How bad is the Omicron variant? Are we ever going to get back to a normal life? Dr. Andrew Basham will join us later for that conversation. But now for our top story. Earlier today, President Biden addressed the nation as people across America headed into the holidays. In his remarks, the president laid out his latest plan to address the rise in COVID cases, now more than 70% of which are the Omicron strain. Not surprisingly, he continued to push for vaccination, even while acknowledging that fully vaccinated people will get COVID.
All these people who have not been vaccinated, you have an obligation to yourselves, to your families, and quite frankly, I know I'll get criticized for this, to your country. Get vaccinated now. It's free. It's convenient. I promise you, it saves lives. And I honest to God believe it's your patriotic duty.
President Biden also said that Omicron is cause for concern, but not cause for panic. But other actions have indicated they may want people to be scared. Here with me now to talk about this and more is U.S. Representative Kevin Brady. He's the ranking member on the House Ways and Means Committee, and he represents the 8th Congressional District of Texas. Congressman Brady, welcome back to the program.
Good to see you, Joseph. Hope you're all ready for Christmas.
Oh, we are getting ready. I got 4 more days, I think, still. So it's just starting for me, honestly. What was your reaction to the president's remarks today about Omicron?
Yeah, so I think too little, too late in the sense that, look, back when he was rushing through and congressional Democrats almost $2 trillion of COVID stimulus, there was only about a dime for every dollar that actually was focused on COVID. At the time, Republicans, especially conservatives, warned the president, look, you're taking your eye off the ball. There's not enough money in here for testing and diagnosis, the things, frankly, families and people need to, as they're looking at their own personal choice and safety here. So now, months and months and months after it was really needed, I think he's starting to buy tests and send them out, issues like that. But it seems to me like he's just taken his whole eye off the ball while he's pursued this real extreme socialist agenda, this pro-abortion agenda, this open borders, this surrender to terrorist type agenda, crime agenda, unfortunately, in America. So, I think the president bears a good deal of responsibility for the country's preparedness at this point.
There's a specific remark in his speech from today that I want to ask you about, and we played it in the opening. He said that it was our patriotic duty to be vaccinated. Now, he said there he expected some criticism, but what's your reaction to that?
So, look, I am vaccinated and I'm boosted. I made that choice. I urge my constituents to take a look at this. Do your research, talk to your doctor, make whatever choice is right for you, and we need to respect that. I think that the wrong way to go about it is the way he's done it, which is first he questioned the vaccine's safety when President Trump was developing it. Then these mandates to force Americans to do it was exactly the wrong way to go about. And I hope the courts will uphold our constitutional freedom to make that choice ourselves. But at the end of the day, the bottom line is, unfortunately, this administration's been all over the road. It is tough when I talk to my constituents. They don't have faith in the authority. They don't trust the government's comments and descriptions about this. And so I think until the president can restore some faith and trust in how the government is handling this, I think we are going to struggle getting those vaccination numbers up. And again, I think, look, you've got to trust people to do the research, talk to their doctor, do the right thing.
The president talked about many approaches to dealing with this latest surge, and including directing Secretary Austin to mobilize thousands of our military members who are doctors, nurses, medics, and military medical personnel to deploy overburdened hospitals in January and February. Now, we also know that many of these medical facilities laid off many personnel because of the COVID vaccine mandates. Is this his way of offsetting those losses, do you think?
You know, I think that's what he's trying to do. My first thought, Joseph, as you were talking about that is, you know, here in Texas, we wish the president paid a tenth of as much attention as to our border and what's going on there, where he's not visited, refuses to acknowledge the terrible humanitarian, criminal, drug trafficking, sex and human trafficking going on there. So I think there is a point here. Look, our hospitals are struggling. Our nurses, healthcare providers, they've been on emergency footing for a year and a half, and frankly, they're exhausted that way. And I think at the end of the day, perhaps that could be helpful for a short time. But I know, too, these same hospitals are asking the president's own Department of Health and Human Services for help, you know, for funding nurses, helping relieve some of that strain. And so far, they're not getting anything from the administration. So this might be one way of trying to ease that temporarily, but I think there are smarter ways.
I want to talk also just about the psychological approach, the attitude we should be taking with respect to Omicron. And President Biden addressed that today. He said that Omicron is cause for concern, but not a cause for panic. But just yesterday, White House COVID coordinator Jeff Zients said that if you're unvaccinated, quote, you're looking at a winter of severe illness and death for yourselves, your families, and the hospitals you may soon overwhelm. Do you see those as consistent messages?
No, Joseph, they're not. And you noticed, as I did, that the administration reacted very severely when Omicron first came out, even though doctors here in Texas, in the Houston Center, were still studying what exactly this virus did. You know, how contagious was it? You know, how severe was it? What kind of symptoms? And if you're already vaccinated, you know, what would the impact be on you? So the administration acted without even knowing the science in this case on Omicron. And I worry, as you do, they're sending mixed signals around. Look, I think I worry about each of these COVID variants because they affect people so differently. An 85-year-old can get COVID and survive. You know, a 20-year-old gets a variant and doesn't. It is still so hard to predict. That's one of the reasons I've encouraged people to take a hard look, you know, at a vaccine and see if it's right for them, just because it's so hard to predict how it affects individual people. But that's why you have to have confidence and respect people's views and opinions on whether they get vaccinated or not.
I think that's exactly right. President Biden also today seemed to suggest that he wasn't interested in lockdowns and specifically was not interested in closing schools. Do you think those are good indications?
Well, I hope so. But the fact of the matter is that science has shown that recent lockdowns and certainly, you know, keeping kids out of school has been so harmful to them, although they still, you know, target parents who are just speaking out and expressing their frustration with local school boards. So they're, I think, hypocritical there. The other point is they continue to push for this $5 trillion Build Back Better bill that has nothing to do with healing the economy, certainly nothing to do with the COVID virus, and drives inflation up. And right now, for American families, you know, you're paying, new study shows you paid $3,500 more this year to buy the exact same things you did the year before. It is crushing working families and small businesses. You know, so look, stop distracting with this big socialist agenda that drives up inflation. Focus on healing the economy and healing in healthcare.
You're the ranking member of the House Ways and Means Committee. You've talked a lot about the economic impact of the federal government's COVID response. What are your concerns there?
Yeah, so I do worry about, even though the president isn't talking about it, we are seeing, you know, like in New York City and other regions, the West Coast as well, you're seeing de facto lockdowns here with vaccine proof for going into restaurants or certain public facilities. I think in many ways we still have in those Democratic states, a strong economic impact, down pressure because of their actions with COVID that really hurt, I think, those regions, especially makes it tougher for small businesses to survive. I think the only thing worse is passing that $1.2 trillion in tax hikes on our job creators and Main Street businesses that are in the Build Back Better plan. It doesn't get the attention it deserves, but it's going to crush small businesses and I think drive U.S. jobs overseas.
In a related point, a new analysis from the Brookings Institute, their centrist think tank, said that rising inflation has erased at least half the average wage gains for frontline workers. Why do you think this is, and what's the impact of that?
Yeah, actually, I think they're underestimating that. I just saw a new study, Joseph, that shows that the inflation's been so high this year that it's wiped out 3 years of real wage growth. In other words, how much are you getting ahead each year for working families? So look at stepping back 3 years in your purchasing power. It is tough. And what the other thing I've noticed too is new studies show that it is the poor and the working poor who are getting hit the hardest with inflation. Yet the president continues to drive policies that drive up prices on families, but also on businesses and on your products in a big way. So look, I think the economy would be doing so much better without the $2 trillion COVID stimulus from March, and certainly will do much better without this $5 trillion Build Back Better scheme.
Well, to that point, at the end of his press conference today, President Biden, in kind of an off-the-cuff remark, said that he and Joe Manchin were going to get something done together. What do you think he meant by that?
I don't know, because I think Senator Manchin was very clear. In effect, what he was telling the president, the White House staff, and his fellow colleagues in the Senate was, you're not listening. I won't be bullied. I am not supporting this bill, period. So the question is, are they going to listen to him? Because he is worried about inflation. He's worried about jobs going overseas. He's worried about all this social spending, including paying people more to stay home than to go back to work. And so the big question, Joseph, is, will they listen to him and respond? And even if they do come back with a smaller package, my prediction is the extreme left in the House will certainly rebel against that as well. So I think there are a couple dynamics here that work for, I think, middle-class families and Main Street businesses who don't want this Build Back Better thing.
Congressman Kevin Brady, thank you so much for your time today.
Good to see you, Joseph. Merry Christmas.
Great to see you. Merry